Hello, and welcome to Beginnings Birth Center's Orientation and Tour. We have designed this orientation to answer many of the most frequently asked questions about the birth center and to give more information to our potential clients. It is important that our clients decide if this model of care is a good fit for them, so we would like to begin by presenting about the birth center, what our clients can and should expect during care here, and what the expectations and requirements are for our clients. Beginnings Birth Center is the first freestanding birth center in southern Colorado. There are several birth centers in other parts of Colorado and hundreds more around the country, but this is a new model of care for our community, so we would like to share more about what it means to be a freestanding birth center. Beginnings Birth Center is a specialized facility focused on facilitating healthy, low-risk pregnancy and natural birth in the midwifery and wellness models of care. There is a lot of information in that one sentence, so let me break that down a bit. We are a facility licensed as a birth center by the state of Colorado and nationally accredited by the Commission for the Accreditation of Birth Centers. This means there are many regulations and minimum standards we are required to meet in order to operate the birth center. We facilitate healthy, low-risk pregnancy. About 85% of pregnant persons fall into this category, and if you have specific questions about your pregnancy, please feel free to ask a nurse or midwife these questions after the tour. Births at Beginnings Birth Center are natural vaginal births. We do not offer medical induction, IV narcotic medication, or epidurals here at the birth center. Instead, we help educate and specialize in supporting natural birth, and we offer the midwifery and wellness models of care. The term midwife means with woman. So the midwifery model is relationship-based care, where you get to know your midwives and your midwives get to know you. This not only allows our clients to connect with the midwives, it also actually helps us to provide better care. To facilitate this care, you will spend at least 20 minutes with a midwife at your appointments. The wellness model means that instead of just finding and treating problems after they happen, we believe in promoting health. Our midwives work with you during your care at the birth center to give options and suggestions to help you be as healthy as possible. We believe that our clients are in charge of their care choices, so we provide education and recommendations for informed decision-making, and then we work to support our clients' decisions. One of the most frequently asked questions, understandably, is, how much will it cost to have a baby at the birth center? Really, the best answer to this is, that depends. Each client's out-of-pocket costs will depend on their insurance company and then their specific plan, so this is a very individualized situation. We do have a prepaid discount package if you are not using any insurance. As part of our services for our clients, we do accept and work with sharing plans, and we are in network with and will bill many insurance companies. To help our clients better anticipate their out-of-pocket costs, as part of the non-covered services fee, we can perform a verification of benefits once we have your insurance information. This will tell you about your individual benefits for maternity services and will list your deductibles, coinsurances, copays, and other information about your plan. From this information, our billing department can then put together an estimate for out-of-pocket costs. We know there are often more questions about this topic, so we are happy to answer individual questions about this after your tour. Now we would like to go over what clients can and should expect from Beginnings Birth Center. You can expect comprehensive family-centered care. Our midwives can see clients for well woman exams, preconception planning appointments, and other women's health needs. We provide all prenatal visits here in the clinic, labor, birth, and recovery in the birth center, and then mom's postpartum care for the first 6 weeks and well baby care for the first 2 weeks here in our clinic as well. We understand that your families are an important part of this whole process, so we welcome children or family members to come to your appointments and birth if you would like them to. We also know that what affects you affects your baby and vice versa. So all of our visits focus on the both of you throughout your care experience. You can expect us to set you up for as successful an experience as possible. Natural birth is not the norm currently in our country, but facilitating healthy, natural birth is our expertise, and we offer information and support throughout care here to help clients have the experience they are looking for. Education is an integral part of birth center care, and there are many ways that education is offered here at the birth center to cover topics like exercise, childbirth education, breastfeeding education and support, newborn care, and new parenthood. We can tell you about classes available here and in our community. We have a lending library with dozens of books on these topics, and there is even more information available through the client portal. The client portal is online access to your care information here at Beginnings Birth Center, and you should receive an invitation to this portal when you sign up for your tour. Through the client portal, you can fill out all the information and paperwork necessary. You also have access to your appointment and medical information online, and there is a section called Educational Forms with lots of resources on a variety of topics. For example, we know that the terminology used regarding pregnancy and birth is almost like learning a new language, so there is a glossary of terms that goes over the terminology used during care at the birth center. Our clients can expect a fantastic team for their care and birth. Our care providers are certified nurse midwives, advanced practice nurses, the same as nurse practitioners, who all have a minimum of a master's level education. The nurse midwives see clients for appointments here in our clinic and attend births at the birth center. We would be happy to tell you more about the midwives here at the birth center at your tour. We also have registered nurses on staff who help with care for our clients and assist at births. There is always a primary midwife on call, and at every birth, one of our nurses or a second midwife will also be present. We also have staff members to help clients at the front desk and birth center assistants who provide extra help when needed. Every member of our team is here because we are dedicated and passionate about care for our clients, and it is an incredible team to be a part of. We also consider doulas to be part of the birth team, as much as the nurse midwives and nurses. Doulas are professionals that provide educational, emotional, and physical support during labor, birth, and postpartum. We highly encourage a doula for all our clients, and first-time mothers and VBAC clients are required to have a trained, experienced doula approved by the birth center team with them for labor and birth. It is our experience that professional doula support is often the difference in a successful natural birth experience. We are happy to provide more information about their role as part of our client's birth team. There is also an informational handout on the portal about why doulas are such a valuable part of the team. We do have a list of doulas approved for this requirement that we can send you on the portal. We understand that the doula-client relationship is very personal, and the best way to learn more about doulas is to meet with them. Doulas offer complimentary meet and greets, and we suggest that you meet with 2 or 3 to decide which doula is right for you. Our clients can expect to have access to the birth center team. Communication is a key part of your care experience here at the birth center. In addition to your appointment times, we have a couple options for communication. The client portal has a great feature called the Message Center. This Message Center allows you to contact our team anytime with non-urgent questions or needs. If you have a random question pop in your head at 3 in the morning, you can message us and we will respond, usually within 2 to 3 days. Often sooner, but we give ourselves a little time in case of busy baby weeks. You can send messages directly to the office staff for scheduling or paperwork questions. You will get messages about any test results from the nurses and can ask questions about those here. You can contact the billing department with any questions about your billing, although some of these responses may take a couple weeks depending on what the billing staff need to find out in order to answer these questions. You can also directly message the midwives in the Message Center to ask any non-urgent care questions you have. In addition to the client portal for these messages, our clients have 24/7 access to a midwife for urgent needs and when you are in labor. All clients receive a call number that they can call or text to directly reach the midwife on call. This brings us to what our clients can expect when they are in labor. Every labor is different, and we understand and support each individual process. Our clients contact the midwife on call once labor begins, and she will be in contact through the process as necessary and advise you on when to meet her at the birth center. Usually, clients labor at home until in well-established active labor. We talk about what this looks like more during prenatal care and classes here at the birth center. Your doula can meet you at home during this time and provide continuous support while you labor at home and when you come to the birth center. Clients can expect to have a birth suite available with all the amenities we will show you on the tour. We have 3 birth suites, so we do have a maximum number of clients we accept into our care each month in order to make sure that we will have a birth suite available. Importantly, clients can expect women-centered care. You can be in any position you choose during labor and birth, move as you desire, eat and drink during labor, and use water for comfort, including our specialized tubs. We do offer water birth here at the birth center. We are equipped with medication and equipment to manage complications or emergent situations for mother and baby. Often we will be able to manage those with mom and baby remaining healthy enough to stay here at the birth center. Otherwise, we have access to emergency services, and Memorial Hospital North is 2 miles east on Briargate. If we transfer to the hospital, a birth center midwife or nurse will go with you to get you settled. Once a plan is in place at the hospital, we fully transfer care from the nurse midwife to the OB hospitalist or neonatologist on call. We do follow up with our clients who transfer to the hospital, and you can return to the birth center for postpartum and baby care after discharge from the hospital if you desire. Our clients can expect us to prepare them for an early discharge to the comfort of their own home. Our clients typically stay at the birth center for around 4 hours after baby is born. We make sure mom and baby are healthy, that mom eats and gets up to use the restroom, and baby eats at least once. We also do the newborn exam and can administer newborn medications if you choose them. After this, what you and your baby need most is rest, so you get to go home and settle in with your new family. You can still contact your midwife with any questions or concerns you have after you go home, and we provide education about the early postpartum time during class here at the Birth Center. As part of the comprehensive care experience at Beginnings Birth Center, we provide couplet postpartum visits for the first 2 weeks, in addition to a 6-week postpartum visit for mom. At the 24 to 48 hour visit, we do the newborn genetic disorder screening for baby, the screening for cardiac defects, we can screen for jaundice, and check how baby is feeding and doing overall. We check in with mom as well and make sure she is starting to heal and see how breastfeeding is going. Beginnings Birth Center staff also files the paperwork for baby's birth certificate and social security card. We check on mom and baby again at a 4 to 6 day visit and a 2-week visit where we do baby's hearing screen and second newborn screen. Once we get the results of the second newborn screen, we will automatically send baby's records to your pediatrician of choice, and the first visit with the pediatrician is usually at 1 to 2 months depending on your pediatrician's preferences. The final postpartum visit is a 6-week visit for mom, but we do still love seeing the babies at this visit. We can discuss and offer birth control options, refer to lactation consultants, pediatric dentists, or other complementary care providers during these visits as well. Finally, we would like to share the expectations we have for our clients. We expect clients to be active participants in their own care, to stay as healthy as possible, because we want you to stay healthy and low risk so you can have the experience you have chosen. While we deeply respect the client's right to informed decision-making, there are a few tests that are required during prenatal care here at the Birth Center because these tests help us determine that a client is low risk and appropriate for birth center care. These are the requirements for prenatal testing at the Birth Center: initial prenatal blood tests, 28-week blood tests, gestational diabetes screening, group beta strep testing, a 20-week anatomy ultrasound, and a quick ultrasound around 36 weeks to check baby's position. All these tests and ultrasounds can be done by our staff at the Birth Center. Our midwives can also offer other testing and treatment, but everything besides these requirements is yours to accept or decline. We expect regular attendance at appointments and communication with your midwives. We know that life happens and you may need to reschedule once or twice, but we need to check on you regularly to make sure you are healthy. We also cannot help with something if we don't know about it, and there is no such thing as a stupid question. So please be open and communicate any concerns or questions you have during your pregnancy, birth, and postpartum. We do expect our clients to meet with all the midwives. We have a team model with a rotating call schedule, and it is our goal that when you come to the Birth Center in labor, you are met by a familiar face. We require our clients to complete certain education classes. First-time mothers and mothers who have only experienced a medicated birth are required to provide proof of completing comprehensive childbirth education with information about natural birth. Beginnings Birth Center clients must complete a breastfeeding class, and there is a breastfeeding class included in the non-covered services fee. Newborn care class is also required for Birth Center clients, and all clients must attend Beginnings Birth and Postpartum Prep class, a class taken between 32 and 36 weeks included here at the Birth Center, where we go over detailed information about coming to the Birth Center for labor and birth, as well as going home after with your newborn. Comprehensive childbirth education and trained experienced doula support are both costs that are not currently covered by insurance, so those are things you'll need to start budgeting for as well. During labor and birth, we expect our clients to communicate with their midwives so that we can provide support, instruct you on when to come to the Birth Center, and offer the best care possible during your labor and birth. We also must listen to baby with a Doppler during labor. This is a handheld device that is used during prenatal visits to listen to baby's heartbeat. We listen to baby every 30 minutes during active labor, and more frequently during pushing, but we can listen to baby in almost any position you choose, and we take the Doppler off your belly in between these checks. Nothing is ever strapped to your belly during labor. We hope that this information answers some of the questions you may have had about Beginnings Birth Center and helps you decide we are the right choice for your care during this very special time. This orientation is designed as a general overview of birth center care, so please feel free to ask the staff any other specific questions you may have, and we are always happy to discuss your specific care options along the way. Thank you for coming to visit us.